Okay, so today we are just going through the last topic of chapter 10. And in this topic, we're basically looking at interventions used to treat sleep disorders. So an intervention is basically a kind of treatment, a kind of therapy. So what are the general interventions or therapies or treatments used to treat people who have sleep disorders, such as insomnia, such as difficulty going to sleep, difficulty waking up in the morning. Okay, so what are the different types of therapies? Now, usually we learn two of these, and the two that we usually learn are cognitive behavioral therapy and bright light therapy. Now, we're not actually doing cognitive behavioral therapy anymore, which is why I've crossed it out, because Vika have actually removed it from chapter 10. We will learn about CBT with reference to phobias when we do chapter 13, but with reference to sleep, we are no longer studying CBT. So the only intervention left in the study design for this year is bright light therapy. So that's what we're going to be covering today. Okay, and bright light therapy is essentially what the name suggests. It's the use of very high intensity, bright fluorescent light to try to readjust or change the kind of sleep timing, okay, the timing of the circadian clock or the body clock, so that a person can fall asleep at the time that they want and wake up naturally at the time that they want. So that's what bright light therapy is about, and that's basically the only thing we're going to learn for today. So we may finish a little bit early today. Okay, so what is bright light therapy? Number one, bright light therapy is an intervention that's used to address circadian rhythm phase disorders. So any disorder that influences the circadian rhythm, and we did look at a few of these the other day, any disorder that influences our circadian rhythm, such as jet lag, such as your sleep getting kind of stuffed up because of shift work, or things like the sleep-wake cycle shift that happens in adolescence due to the release of hormones during puberty and all that stuff. That basically is something that can be fixed through the use of bright light therapy. Okay, so bright light therapy can be used to address and fix and treat all three of the circadian rhythm phase disorders that we looked at in our last online session. Now, bright light therapy is being exposed to intense, high intensity, high brightness kind of light. Okay, this light is safe, so it's safe to be exposed to this light. It's not going to harm you, it's not going to burn your skin, it's not going to do anything like that. It is a safe amount of natural or artificial light that's used. Okay, sometimes we use natural light, but in most cases, it's artificial light that's used. So artificial light means that the patient is given a light box. Okay, a light box is what we see in the image here. And a light box is kind of like what its name suggests. It's just a box or a kind of device that displays high intensity fluorescent light. And this light is actually the light that kind of stimulates. It's different from blue light, okay? The blue light that comes from your phones or from our laptops or tablets is not the kind of light that is good for you, okay? In fact, it's the light that actually suppresses the release of melatonin, and it delays the release of melatonin. The kind of light that comes from a light box is a little bit different in nature. It's high intensity fluorescent light. So essentially it's light that actually promotes the release of melatonin and ensures that melatonin is released at the correct time. So what we're going through is bright light therapy, and bright light therapy is used to address any circadian rhythm phase disorder, such as jet lag, such as sleep problems that come from shift work, and sleep problems that come from the sleep-wake cycle shift. Okay, bright light therapy can also be used to address just general insomnia as well. So we're not going to ignore insomnia, even though that topic has been removed from our study design. I know that insomnia is the sleep disorder that most of you would be most familiar with at this point in time. So bright light therapy is widely used to address any sleep condition or any sleep-related disorder where there is a problem with you waking up at the right time and there is a problem with you falling asleep at the right time. In terms of how long the bright light therapy takes to correct the circadian phase rhythm, it really depends on your age, okay? They say that bright light therapy works a little bit better for people who are younger compared to older people, because naturally, you know, older people have less quality of sleep. We've learned about that in chapter 9. Also, it depends on how well you use it. So if your psychologist or your sleep therapist prescribes you a light box and you only you're only turning it on every other day or every other week, you're not using it consistently, then it's going to take a longer time for you to basically reap the benefits out of that. But yeah, it really depends on a number of factors as well. Okay, so there's no exact time. But I would say for some people it might start working as soon as a month. For others it might take a few months. Again, depends on the original severity and intensity of the sleep problem. Okay, so obviously when we're looking at bright light therapy, it's the use of a light box, and this light box emits artificial high intensity fluorescent light, which is very bright light. That's why we call it bright light therapy. And the exposure of this light actually promotes the release of melatonin at the correct time. So if because of your disrupted sleep-wake cycle, your melatonin is only getting released at, let's say, 10 o'clock in the nighttime or 11 o'clock, hence making you only feel sleepy at about 1 a.m. or 2 a.m. in the morning, being in front of a light box, sitting in front of a light box for 20 to 30 minutes every day after you wake up can actually help to reset that schedule so that your melatonin actually gets released at about 8 o'clock or 9 o'clock in the evening, which then allows you to fall asleep or go to bed and actually feel sleepy by about 10 or 11 o'clock in the nighttime, which is an okay time compared to falling asleep after 12. Okay, so essentially bright light therapy, the light, whenever we talk about melatonin, and we know melatonin is the main sleep hormone, we have to realize that melatonin is influenced by our exposure to light. Okay, so that's why if you've ever watched videos about how to improve your sleep, you would realize that being exposed to bright light therapy or being exposed to any kind of bright light first thing in the morning, preferably natural light for people who don't have sleep disorders, but being exposed to that natural light, opening up your curtains, or just having a quick walk outside, even if it's just a walk around your backyard, is actually good because it helps your body to realize that it is now morning, and that melatonin can start to get then released in the evening time. Okay, because depending on when your melatonin is released in the daytime, that will then influence, or depending on when your melatonin stops getting released in the daytime, obviously, like we said, for most people, melatonin will stop getting released around 7 o'clock in the morning, which then makes them wake up. Okay, now if that's what is happening for you, then essentially that means your melatonin will start to get released at about 7 or 8 o'clock in the evening, which means you'll fall asleep at a normal time. The problem with not being exposed to proper light first thing in the morning is that your body doesn't sense. And this is a problem for all of us because now we're all kind of locked in, not going out as much. Your body doesn't sense that, oh my God, it's now morning, it's now day, it's time for me to wake up. Okay, so essentially a lot of us are not naturally waking up. We're waking up because of our alarm on our smartwatch or an alarm on our phone or just simply an alarm clock. We're being forced to wake up. And that's not the natural way of waking up, but unfortunately because of the fast-paced lifestyles that everyone has these days, that's the only way we can wake up on time. Okay, so being exposed to natural light first thing in the morning, or alternatively, being exposed to light from a light box, even if that light is artificial, doesn't matter, it's still good, can actually help to tell your body, to confirm to your body and your brain that it is now morning time, it's time for melatonin to stop getting released, and melatonin stops its work for a little while, and a few hours later in the evening, it starts to get released again. Okay, so that's essentially what bright light therapy is about, how exposure to light can cause our internal body clock to come forward or to shift back, okay, depending on what time we want to wake up. If you're a shift worker, you need to be awake at times when everyone else is asleep. So the time at which you actually expose yourself to the light box will be different from a person who has a different occupation or a different job where they don't have to work shift work or night shifts. Okay, so it's about bringing your sleep-wake cycle, using bright light to bring your sleep-wake cycle to a desired schedule, and that desired schedule is dependent on your lifestyle, on your occupation, and on your needs, depending on what time you need to wake up or what time you want to fall asleep. Okay, so that's bright light therapy. If there's any questions about bright light therapy, just put them in the chat box. Whoops, what have I done? Close that. All right. Okay, we've got a question here. Okay, question. So bright light therapy. Bright light therapy doesn't really increase the production of melatonin. What it actually does is it actually signals to the body. So when you're exposed to bright light, let's say for a normal person, okay, if I was to do bright light therapy, I would wake up out of bed, I would turn on my light box, and then I would sit in front of my light box for about 20 to 30 minutes. Okay, that's just generally the amount of time that they prescribe. So I'm sitting in front of my light box that's on my table for 20 to 30 minutes, and then I decide to go about my day and start doing everything else. Okay, now me sitting in front of that light box for 20 to 30 minutes signals to my brain that it is morning, that it is daytime, and that melatonin has to now stop releasing. It just has to stop. Okay, and when melatonin stops getting released, that's when I'm going to feel like I'm actually awake, that I'm actually alert and I'm awake and I'm ready to take on the day. Now, fast forward a few hours later and it's evening time now. It's about 7 o'clock, 8 o'clock. I'm going to start to feel a little bit drowsy. I'm yawning here and there. And that's a sign that my melatonin is starting to get released again. Okay. When my melatonin starts to get released in my body in the evening time, or in your brains in the evening time, that signals to your brain that it will almost be time to sleep in a few hours. So I need to start preparing to kind of like deactivate and to not be too stimulated in terms of brain activity. Okay, so essentially what bright light therapy does is it doesn't increase or decrease the production of melatonin, but changes the timing of melatonin. Okay, changes the timing of melatonin to be released at a specific time that will allow us to fall asleep at a specific time and wake up at a specific time. And that's what we call as the desired schedule. Okay, now I can't give you a specific, like pinpoint a specific time, because that time will be different for everyone. So if I want to wake up, if I want to have a normal sleep pattern, that's the example I just gave you, you know, waking up at 7:30, feeling asleep at 8. For people who work shifts, they might have to change the timing of when they sit in front of the light box accordingly to when they want to wake up. And usually a light box is not something you self-administer. You usually have to sit with a sleep therapist, or you have to do a lot of research to understand how to use the light box correctly. Because again, it is a bit of a technical thing. It's not something you can just administer or just learn how to do straight away. You've got to really understand how it works first. Okay, so remember, and honestly, this is one of those topics that can get a little bit confusing. So remember, bright light therapy doesn't increase the production of melatonin. It simply adjusts the timing of when melatonin is released and when it stops getting released. Adjusts when melatonin is released. So it almost acts as a signal. So obviously when you're exposed to bright light first thing in the morning, it provides a signal that, okay, now melatonin, it's time for you to stop releasing. And obviously when it stops releasing at that time in the morning, it means that it will start releasing at the correct time in the evening, okay, without delaying or without making you stay up late, unable to go to sleep. So that's what bright light therapy is about. Okay, let's look at a practice question. Oops, forgot to roll out that scribble. Okay, so this practice question, just to show you guys, I know it's quite early to do practice questions for this right now, but let's just do it just so you get an idea of how it actually looks. So the question is, Tina is 14 years old and was diagnosed with delayed sleep-wake phase disorder, aka sleep-wake cycle shift in adolescence, where she finds it very difficult to wake up in the morning and she always wants to sleep in. As a result, she has been missing a lot of school. Outline how bright light therapy could be used to address her delayed sleep-wake phase disorder, okay? Or in other words, her circadian phase disorder. So I'm just going to show you guys the actual answer for this. I'm not expecting you to write a response for it right now. But essentially what we're looking for are these kind of words in bold, okay? These are the ideas that are important for you to mention. Now, if Tina was to go through bright light therapy, she's going to sit in front of the light box for around 20 to 30 minutes every morning, as I said in my example before. It needs to be in the morning because this is the time that we need to adjust, okay? So she doesn't want to sleep in. Tina doesn't want to sleep in, okay? She can't resist. It's something that she can't resist. So because she finds it difficult to wake up in the morning, that's the period of time that Tina needs to sit in front of the light box, okay? Now, if, for example, I'm working night shift and I have to wake up at 2 a.m. or 3 a.m. to go for my night shift at the hospital, I will then sit in front of the light box at that specific time. So as soon as I wake up about 20 to 30 minutes earlier than when I have to get ready, and I sit in front of the light box at 2 or 3 a.m. because that's the time that's difficult for me in that example to wake up. Okay, the light from the light box signals to the brain's suprachiasmatic nucleus. Okay, and this is something we'll be looking at a little bit more next week before we start mental health. So the brain suprachiasmatic nucleus, that it is daylight. Okay, so like I said before, when you look at the light on the light box and you're exposed to that light, your brain, specifically there's a part in your brain called the suprachiasmatic nucleus, and that is the part of the brain that will detect the light and will basically send the brain the cue that, okay, melatonin needs to stop getting released. Okay, so that's the next step here. In turn, the suprachiasmatic nucleus can adjust the biological clock or your body clock, stopping the release of melatonin from the pineal gland. Okay, and that's basically the gland through which melatonin is released in our bodies. And so just linking it back to the scenario, so eventually Tina will be able to wake up easily and will not feel sleepy in the morning time, and it won't be as difficult for her to wake up because she's now retrained her brain to not feel sleepy, to not feel drowsy first thing in the morning, because her brain's melatonin timing and melatonin release schedule or melatonin release roster has now kind of changed because of the use of the bright light therapy. Tina had a bad habit of napping for 3 hours. Would BLT during the day allow her to stop this habit? Or does napping just mean? Yeah, napping is, there's always like there's a clear distinction between napping and actual sleep. Sometimes, you know, sometimes you might have a perfect 9 or 10 hours of sleep the night before, but then you come home and you're just so exhausted, you're just so tired that you just have a nap. Again, it's important to distinguish that a nap is usually not more than a few hours. A nap should usually be like maybe maximum 1 hour or something like that. If it goes for more than that, then it's kind of like classified as sleep. But yeah, so I wouldn't say napping for 3 hours would be a nap. It's more of a mini sleep because you're already gone into like the first cycle of sleep or the second cycle of sleep by then. Okay, remember it only takes about 80 to 120 minutes for us to actually go through a full cycle of sleep, which is NREM stage 1, 2, 3, 4, and then REM. That's like an entire cycle. And most of us can complete that cycle within 2 hours. So more than 2 hours is considered sleep, in my opinion. Yeah. So again, it depends. Yeah. Okay. Yeah. So basically, that's bright light therapy, and I think that's about it for our lesson today. Just the takeaways from this slide is just remember bright light therapy is used to readjust the timing of when melatonin is released. Remember, the minute that melatonin is released, that's when you start to get sleepy. The minute that melatonin stops getting released, that's when you start to get, that's when you start to feel awake and alert and ready to face the day. And so the main idea of sitting in front of a light box first thing in the morning for the majority of the population would be to stop melatonin from getting released. And by stopping melatonin from getting released, we don't feel sleepy or drowsy anymore, and we feel nice and awake and nice and alert and ready to face the day. All right, a question? No, we're not doing CBT. Okay, so like I said before, cognitive behavioral therapy or CBT, only for this chapter. There is CBT in chapter 13. We will be covering CBT with reference to mental health, but we are not covering CBT with reference to sleep. So if you've got that in your notes or you've got that in your any resources you have, just put a small cross next to it, because CBT is not something that VCA want you to do. Dysomnias are the same thing. So dysomnias are also not covered because VCA have removed it. So remember, guys, from this chapter, chapter 10, we're not doing dysomnias. VCA don't want us to do parasomnias, and they don't want us to do CBT as an intervention for sleep disorder. So those are the 3 topics that have been removed, and that is quite a few huge topics actually that have been removed, which is why we were able to finish this chapter so quickly. Alrighty, so if everyone else is all good with bright light therapy, I will post up a video for this as well if I can find a good one, so you can understand it a little bit better. But again, if you have any questions about this, you can always ask me in the next online session as well. All right, so in that case, you guys are free to go and enjoy your weekend and take care, and please do the learning activities for this spread.